pain affects more Americans than diabetes, heart disease, and cancer combined. While prescription pain medications are an important component of pain management, the reality is that these products are prone to abuse and misuse. In fact, more than 12 million people reported using prescription pain medication non-medically in 2010. Here to talk about pain management in the complex treatment landscape is Paul Gelino. He is with the U.S. Pain Foundation, and also Dr. Melanie Rosenblatt, Medical Director of Pain Management. Good morning to you both.
Good morning.
Good morning.
Dr. Rosenblatt, why is the treatment of chronic pain so complex?
The treatment of chronic pain is so complex because, firstly, it affects so many people. Over 100 million people are affected with pain. And while pain medication is the mainstay of treatment, these medications are prone to abuse.
And then, Paul, tell us a little bit about your experience with chronic pain and maybe what led you to create the U.S. Pain Foundation.
Sure. 12 years ago, I was lifting a box and twisting, and I broke my back, which severed my sciatic nerve, which began my chronic pain journey. And on that journey, I realized I needed to be more empowered, educated, and advocated for. So I decided to start the U.S. Pain Foundation to bring resources and materials to people with chronic pain that were similar to myself.
Well, and certainly, especially when, I mean, it doesn't matter where the pain is, but you kind of seem to become dependent on that because you want that relief, I'm sure. But Dr. Rosenblatt, what roles do patients and doctors have to play in reducing drug abuse if it turns to that?
So the study was conducted by Teva Pharmaceuticals in collaboration with the U.S. Pain Foundation and the American Academy of Pain Management. And what this study found was that both healthcare providers and people who live with pain want to take personal responsibility for prescription drug abuse, but they're uncomfortable having the conversation. So I think this highlights something we already knew. It's hard to have that conversation, but having that conversation is the beginning.
What is Pain Matters, and why would you say resources like this are so important?
The resources are important because the study also highlighted that both healthcare providers and people who live with pain want more education, they want more information, they want tools and resources, and this website, painmatters.com, delivers those resources.
Paul, why would you say these survey findings are so important for people to pay attention to?
The people with pain, the survey was extremely powerful and insightful to people with chronic pain because it made us realize that we want to take responsibility. One of the most powerful insights of the survey was that healthcare providers and people with pain want to take responsibility for abuse in America with prescription drugs. And also, we also want to start that conversation. It's an uncomfortable conversation, but we need to start it.
So what's the first step that we need to take, you know, if we know somebody's struggling with this misuse or this pain? Is it just going to the website and starting there? Is that the first step?
Well, painmatters.com is definitely a first step in learning to speak to others and to how to talk to your doctor. So that's one step. Connecting with others and starting that conversation with your doctor is very important.
Dr. Rosenblatt, Paul, thank you so much for sharing these resources. We really appreciate it. Great to have you on.
Thanks for having us.
Thank you.
We're going to have more on this segment posted online. All you got to do is go to fox4morningblend.com. It is all about the Kate Spade on this Fashionista Friday, where you can find designer brands at affordable prices.